Overweight and obesity have become significant health issues in our modern world. Almost two-thirds are either overweight or obese, which means it is an issue that affects a large number of people. And while there are a number of individual, social and environmental factors causing overweight and obesity, the underlying physiological mechanism relates to energy balance. Energy intake from food is greater than the energy expended by the body. We gain weight by storing the excess energy as body fat. On the other hand, if we want to lose weight, then we need to expend more energy than we consume. Unfortunately, weight management in practice becomes quite complex because both energy intake and also energy expenditure are really difficult to measure accurately. And they're also constantly changing, and they're affected by many different physiological, psychological, sociological, and also environmental factors. This review paper provides a really nice explanation of how energy balance is regulated, and it clearly shows that energy balance regulation is a dynamic relationship between biology and also behavior. Energy balance is controlled by a number of regulatory mechanisms in the body. Food consumption results in an increase in appetite-inhibiting hormones such as cholecystokinin, peptide YY, and glucagon-like peptide 1, whereas exercise and physical activity results in an increase in appetite-stimulating hormones such as ghrelin. And these regulatory processes are designed to keep energy balance nicely controlled so that we have a stable body weight over long periods of time. Interestingly, the strength of the signals regulating energy balance in the body are not the same during overfeeding compared with underfeeding. Our bodies tend to defend weight loss when there's an energy deficit much more strongly than we defend weight gain when there's an energy surplus. Adaptive thermogenesis is the term used to describe how the body attempts to maintain homeostasis in the event of a disruption in energy balance. A good example of adaptive thermogenesis is when an individual attempts to lose weight and adheres very well to an energy restriction that should result in weight loss of, say, 1 kilogram per week. However, the actual rate of weight loss is less because the body reduces its metabolic rate to try and offset the energy deficit and defend the weight loss. This is a good example of why it can be very difficult to lose weight and then keep it off in the long term. In fact, most weight loss studies actually show that people can lose weight relatively easily in the short term, but find it very difficult to keep that weight off in the long term. A typical pattern of weight loss in response to a weight loss intervention is some initial success over the first 3 months, but then a gradual weight regain to the point where much of the weight initially lost is regained in the first year. But the amount of weight loss does vary depending on the intervention. This paper provides a nice review of the amount of weight loss that is likely to result from different interventions involving exercise. It suggests that weight loss with resistance training only is likely to be around 0 to 1% of initial body weight. Aerobic training might achieve up to 3% weight loss, but combining aerobic training with dietary restriction can achieve weight loss of between 5 and 15% of initial body weight. And this clearly shows that combining both diet and exercise appears to be the most effective thing for weight loss. The other key ingredient for successful long-term weight loss is, of course, adherence. Successful weight loss often requires the support from health professionals, community organisations, family and friends for individuals to adhere and maintain the behaviour changes required for success. And the management of patients with obesity is often done in multidisciplinary teams, and it is important to understand the role of different health professionals in the team. For example, a patient being managed in the primary care setting might have a GP managing any medical complications and also coordinating the care of other health professionals, such as an accredited practicing dietitian who might provide assistance with appropriate food choices, a psychologist supporting behaviour change, a nurse providing regular assessment, and also an exercise physiologist supporting the patient to become more physically active. Weight management is definitely a challenging area of practice, and it's important to recognise that there is no one-size-fits-all approach. Many people respond to different types of support, and using a patient-centred approach which respects the patient's values and preferences is most likely to achieve the best outcomes in the long term.